After 50 years of smoking, 67-year-old Stephanie Torrigelli knew she was at high risk for lung cancer. 2 years ago, she enrolled in a study, and sure enough, a CT scan picked up an early tumor before she had any symptoms.
I said, God gave me a second chance in life, and that's how I look at it.
Now, for the first time, that screening test has been proven to save lives in heavy smokers like her. The study looked at more than 53,000 men and women who smoked the equivalent of a pack a day for about 30 years. These older smokers, ages 55 to 74, were screened with either chest X-ray or a more sensitive CT scan that gives a three-dimensional view. After 5 years, those who got the scans had 20% fewer deaths from lung cancer.
The 20% reduced mortality indicates that this approach is able to save lives.
The effectiveness of CT scanning for lung cancer has been debated for years. A key concern? The test picks up lung abnormalities like scars from past infections that are not cancer. These are common in heavy smokers and can result in costly, anxiety-producing tests. Another concern? Radiation. A CT scan, even low dose, delivers about 15 times more radiation than a chest X-ray. But the new study suggests the benefit of finding lung cancers early trumps the risks.
This is one of the most important cancer findings in the last 10 years. It proves that you can save patients' lives by detecting cancer early.
4 years ago, Barton Lazarus had a CT scan that caught an early lung cancer, missed by chest X-ray. Doctors removed that tumor, and today he's cancer-free. Since Torrigelli's lung surgery 2 years ago, she's also cancer-free and vigilant about screening.
I can walk, I do everything that I did before. I'm feeling good. Cheers. I feel perfect.
A good screening test is so important because right now 85% of patients diagnosed with lung cancer die because it's not caught soon enough. Katie?
And I understand, John, there's something like 80 million current or ex-smokers in the United States. So should everyone go out and get screened, or all of those people at least?
I don't think everybody, but certainly in light of this study, I think the heavy smokers, it's very reasonable for them to talk to their doctors about getting screened. But remember, as we said, there are some drawbacks. For every 300 people who were screened, 1 life was saved, but 70 people were told that they had an abnormality that turned out to be totally benign.
And tell me how much this test costs, at least right now.
Right now, about $300 to $400, not covered by Medicare or most insurance companies. That could change when the government takes a closer look in the wake of this study. But remember, it's terrific to pick up a lung cancer early, but if you want to prevent it from developing in the first place, stop smoking, or better yet, never start smoking in the first place.
All right. Dr. Jon LaPook. John, thank you.